Hey guys, welcome back to my channel. Today I'm coming at you with a little bit of a different video from a little bit of a different angle because if you guys didn't know, I went through hip surgery on Friday, March 29th. Today is Monday, April 1st. And so I just kind of wanted to go through what the surgery day was like for anybody who may go through the same surgery and wants to have a better idea of what to expect. But first of all, I'll kind of explain what my surgery was. So what I had done was I had a labral tear caused by a cam type femoral acetabular impingement in my left hip. So this is caused when your femur, so your thigh bone is your femur, and your hip, they kind of form a ball and socket. And then there's like a cartilage that acts as like a rubber band between the two, and it cushions the bones so that they don't rub together. So that cartilage is called the labrum. So you have that in your hips, both hips, and in your shoulder you also have a labrum, which you can also tear in your shoulder. And so mine was torn. That's a whole other story of how it got torn. I'll do a whole other video on that. So I had scheduled my surgery for a Friday, and it was scheduled to be Friday at 8:45 in the morning. That was a surgery time. My call time was 7:45 in the morning. But everything kind of started in terms of prepping the night before. So I stopped eating and drinking anything before midnight the night before. So I had my last meal at like 9:45, or I finished about 9:45 p.m. And then I went home to do some last minute preparation, like packing my backpack for the hospital with like extra pants like that would fit over like a big bandage on my hip, and extra water, anything like that I may need. Did that. I had put clean sheets on my bed because they said it's best to sleep on clean sheets, and also sleep in clean pajamas before, just to prevent any sort of infection that may happen, which is unlikely, but that's just to prevent it. And they also say to prevent infection to use antibacterial soap when you shower, either in the morning before or the night before you have your surgery. So I did that, and then I went to sleep around like 11 p.m. And then I woke up at like 6 a.m. so I had time to read my Bible and pray before I went to the hospital with my parents. So we left around 7:15 a.m. to get there. It was about 15 minutes to get there. It was pretty close. So yeah, so we arrived there around 7:30, and we tried to make our way to the surgery center. We got there, we checked in around 7:45. We went through some paperwork and everything, and confirmed some information. And then I sat in the waiting room with my parents before the nurse called me back around like 8 a.m. They had me change into the hospital gown and robe, and they had me put all of my clothes and all of my belongings in a locker. My shoes, everything. The only thing I kept on me was my glasses because I'm blind. And I had a hair tie in my hair, and they said as long as there's no metal, you can keep them. But then they took my glasses before I went into the OR. So yeah, they had me changed. They had me do a urine sample because I'm a female. They wanted to make sure I wasn't pregnant, which wasn't pregnant. And then they had me lay in my hospital bed, and the nurse came over and started doing just some confirmation things, some making sure they had the right hip, which they didn't have the right hip. They didn't have the correct hip on their paperwork. They had it written down that the surgery was on my right hip, which it was on my left hip. So that was good to confirm. And then the other nurse put the IV on me. They asked me a few other questions about like last time I ate, any medicines I'm taking regularly, things like that. They got my blood pressure, my heart rate, all of those things. After the nurse was done checking me in, I just stayed in the hospital bed, and the anesthesiologist came in and was also confirming things with me, if I had ever had anesthesia before. I should also say that they tell you not to eat or drink before midnight because of the anesthesia, because it can mix with your stomach or whatever. So yeah, the anesthesiologist came and asked me a few questions and confirmed everything. And then I was just waiting for the surgeon to come and confirm everything also. And when he came back, he signed yes on the hip that they were going to do the procedure on while I was awake, just to make sure everything was good to go. At this point, it was about 8:50 because everything else took a little while, even though my surgery time was 8:45 in the morning. Around like 8:55, the nurses rolled me to the OR in the hospital bed. Got there, and like there was like the anesthesiologist, there was a nurse in there, the PA, the physician's assistant for my surgeon, I think that was it. There may have been one other person. But the whole time for this, I was awake and lucid. The anesthesiologist started pumping something in me, and I started feeling like really, really loopy. I remember at one point saying, I either said I feel really drunk or I feel really loopy. And I remember everyone like laughing. And at that same time, the physician's assistant put like these plastic boots on my feet so they would prop my feet up while the surgeon was doing my surgery, so that I was like laying flat. And I remember seeing the surgeon putting on his like surgical gown. I remember them talking about that they would sedate me on my hospital bed, and then they would move me to the surgical bed or whatever after I was out. And that was like the last thing I remember. And then I was out. And then being like starting to wake up, and I thought they accidentally woke me up mid-surgery and they like made a mistake, but they obviously didn't. I was starting to wake up and everybody was like hustling and bustling around me. When I started to actually wake up, I was in a hospital bed in the recovery room. Just finished, and the nurses were like so amazing. There were like 4 around me, like checking on me periodically. And as soon as I was like lucid enough, I started to feel like the utter pain in my hip. It was more like a dull pain. It wasn't like a sharp pain from like the incisions or something. But I wasn't like lucid like this. I was very loopy, almost like if you were just waking up from like a nap. I remember being in like such pain that I didn't know how to communicate because I was like just waking up, that I was like eyes closed and like in really like I was in pain, and I was like crying, but not like a sobbing cry. I was just like, this is so freaking painful cry. And the nurse came over and she was like, on a scale of 1 to 10, what's your pain? And I immediately said 10 because it was so painful. At that point, they gave me painkillers. They gave me Oxy, and then they gave me also Tylenol and something else. I'm not sure if it was because I had like an allergic reaction to the narcotics or because that's just a side effect of narcotics, but I started getting like super itchy, like all over my like face and like my upper body. So I was just scratching myself, and my parents said they came back and they said I was like itching myself really badly, even though I don't really remember like itching myself that badly. And I remember rubbing my eyes, and then the nurse came back and told me not to because I could scratch my cornea. But eventually the pain went down, and I remember there was a clock like right in front of like my bed, so I could see what time it was, and I swear it was like it felt like 15, maybe 10 or 15 minutes went by, but this was all over the course of like an hour and a half. Just felt like super short, but it was because I was just waking up. But when they gave me the medicine, they also had given me like crackers to eat because you're not supposed to take it on like an empty stomach. And I hadn't eaten anything since the night before, which was really hard for me because I am like a fish. I drink so much water, and to not drink water since like the day before was like really hard for me. And so I was asking for water, and they gave me some ice chips, and that wasn't like sufficient. I'm like, give me a freaking gallon of water, please. But no, they were really great. And as soon as I was lucid enough, the nurses came over and they started trying to put my clothes on me from my locker that they had gotten, and got my clothes on me. And then I got up to get like my pants and my underwear back on. And when I got up and I went to they moved me to a chair, it wasn't just like a normal chair, it was like a reclining chair. And as soon as I got to the next chair, I was so nauseous. It was because of I think it was because of the painkillers or the anesthesia, I'm not sure, but I was really nauseous. So nauseous, they gave me a barf bag and then they gave me some ginger ale, but I was like not having it. So I sat in the chair and I was like out of it still. And I remember my parents were there and the nurse was going over like all of my discharge things because it's an outpatient procedure. They were going over all of the discharge things of like going like crutches, medicine, everything. And all the while I was just like so out of it and still scratching myself profusely. At one point they either rolled me out of the hospital to our car that my dad had pulled around. They either rolled me out in the chair I was in or they moved me to another chair. But I remember moving and I felt really nauseous, so they probably moved me to another chair. And then they rolled me to the car and then I slid into the back seat with my arms. And then as soon as I got into the car, I felt nauseous again. So anytime I moved, I was like really, really nauseous. I wanted to throw up. So at this point it was like 2 p.m. and I think I got out of the OR around like 11:15. So then we got home like 15 to 20 minutes later and I just immediately went to bed because I was so just out of it and tired and in pain, and I had like very reduced range of motion in terms of like moving my foot like this way or that way. Like I could move it, like I could walk, I could put weight on it, but not like a ton of weight. Obviously, they say to do like 40% weight bearing. But it was really uncomfortable to like move from like side to side. I pretty much did that for the rest of the day. So that was like 2 p.m. I was just very nauseous and didn't want to eat anything. My parents got me kava and I love kava, and I looked at it and I wanted to puke. So I ate like nothing that day. I ate like a few crackers and some water. And then I took some Tylenol later that night and I immediately puked. So that is my surgery story. I will do another video on how I got to the point of needing surgery, but that is, everything I have to tell you guys about my surgery day. It really wasn't that bad. I think I was expecting it to be really bad, which I think was a good thing, only because I was preparing myself mentally to like be out of it, not be able to move, for it to be awful, and it wasn't as bad as I thought it was going to be, which was really comforting, I think. But yeah, so if you guys have any questions about like if you're getting the surgery, or you want me to answer a question about like what the surgery day was like or anything like that, let me know in the comments below and I will hopefully answer. So yeah, thank you for watching, guys. Bye.